We all hope for a long, healthy and happy life. This is captured in the African blessing. May you reach old age, may you have children, and may you live to see your children's children. And that's a quote taken from our speaker, Dr. Julita Anabanjo. Julita is a public health physician who has worked across the African continent since joining the UNFPA in 1995. He serves as the UNFPA Regional Director for East and Southern Africa, working on addressing sexual and gender-based violence in conflict settings such as South Sudan and the Democratic Republic of Congo. UNFPA has commented across this pandemic about the impact of COVID-19 on older women in the East and Southern African region, and it threatens to undermine gains made to ageing in Africa. Conflict, emergencies and instability are linked to increased interpersonal violence, particularly against older women and children, and women and older women and children. And pandemics are no exception. So we're delighted today to be in conversation with Dr. Anabanjo and to explore the impact of COVID-19 crisis on older women in this region and opportunities to collectively support older women. And before I hand the floor to Julita, I wanted to just make public that the IFA does not do enough in this area. And so I've already reached out to Julita and said, we need to have a conversation, after this webinar, this town hall, because IFA, along with organisations that you represent, need to be standing up and understanding how we can best support the work of UNFPA, but work within that region and at a country level. So welcome, Julita, and I hand the floor over to you this morning.
Thank you, Jane. It's good to see all people all over the world, and really thank you for your kind introduction. And a shout out to Andrea as well for all the logistics in getting this done. I am particularly pleased to be part of the IF virtual town hall on older women in crisis. And I bring you warm greetings from UNFPA's Executive Director, Dr. Natalia Kanem, and all the people in UNFPA. In fact, many of my colleagues from UNFPA have joined this session this morning. Today, we extend really that solidarity that Jane, you spoke about, to all of us who are battling the COVID pandemic and who've lost someone near and dear from this extraordinary virus. We also extend our deepest condolences to the people of Lebanon as they deal with their heartbreaking tragedy and loss of life from the shocking explosion in Beirut that took place on Tuesday. It is in unprecedented, volatile, complex times that we find ourselves. And if ever a time, this is now more than ever that we need that global and collective solidarity and collaboration and really stepping up as we all must. And so really, I do want to appreciate the partnership that we do share with IFA. It might not be specifically in Africa, but definitely in Eastern Europe and Asia Pacific. And I am also looking to having those conversations with Jane later to look at broadening into Africa. Before I speak specifically to COVID and the older women in crisis settings, allow me to briefly introduce UNFPA because I'm not sure to what extent you know us, but we are the United Nations Sexual and Reproductive Health Agency. And the foundation of our work is based on the landmark program of action of the International Conference on Population and Development. Many might know it as the Cairo Agenda in 1994. And last year we had the opportunity to actually celebrate 25 years of that Cairo Agenda and to look back and to say, had the agenda been achieved? And indeed, through the Nairobi Summit on ICPD 25, many stakeholders recommitted to finishing the unfinished agenda within the context of the SDGs. Our mission is to ensure equitable access to sexual and reproductive health services, rights, and choices for all. And if anybody can see this, our mandate is delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. And you might not have aging there, but indeed we look at a life course approach. So what we do for young people, we feel is really key for healthy aging later in life. We have committed to what we call our 3 zeros, our transformative results. One is to end preventable maternal deaths, end unmet need for family planning, and end gender-based violence, including harmful practices such as child marriage and FGM. And to do this in the more than 150 countries that we do work with across the world, no matter the context, whether it's humanitarian or development, and based on really a solid foundation of strong population data and analysis. And as it relates particularly to older persons, and that's why we're really excited, you know, the ICPD program at action, the Madrid Plan of Action on Aging, the work of WHO on Healthy Aging Agenda and the Decade of Healthy Aging, all define the work that we do as UNFPA. And in 2016, we actually developed our global program on aging. And if my colleague, Alana Armitage, who's the Regional Director for Eastern Europe and Central Asia, she also convenes a UNFPA Global Aging Network that works closely with partners like the UN Department of Economic and Social Affairs. And I know you had our colleagues online at the last session. But also with WHO, and in fact, last week as well, Natalia Kanem, our Executive Director, and Tedros from WHO had a webinar on aging and looking particularly at health and rights of older people, but also with regional commissions of the UN, with the Ditchfield City Group on aging, when we look at data with Help Age, and of course with IFC. And through our policy and research and dialogue, we really are able to advise governments and help them to not only look at the demography of aging, but also matters of fertility, understanding household structures for older persons, looking at safety and social protection, and really promoting active aging. And I did want to, before I really go into the topic, is to really share that this year also presents an opportunity, because we do mark the 25th anniversary of the Beijing Platform for Action. And so we join the UN Women and other partners in what is called a Generation Equality Agenda, which we had hoped we'll all celebrate this year, but we're postponing to next year. And through those various action coalitions, we are trying to ensure a gendered dynamic to aging and the role that older women play, and particularly also another celebration, Security Council Resolution 1325, which talks to women, peace and security. So now allow me to turn to the topic, and again, to really appreciate IFA, because, you know, I think this probably is, in my mind, you know, the one time that we've had an opportunity to focus on a geographic location in Africa and on an older person, and particularly on women. And you know, so I really congratulate IFA and Jane for picking this particular area to frame the conversation today. I will actually frame my remarks in 3 parts, a little bit about the demography of aging in Africa. And I want to do that because I do think it needs to be highlighted. But then how COVID is impacting older women, and particularly in crisis settings, so in refugee settings, for example. And what areas we feel as UNFPA need, you know, you as partners to really collaborate around and to lend your voice and activism towards. So if that's okay, I'll just quickly, I'll try and go fast. It is comprehensive. We could spend the whole day talking about Africa and aging populations there. But maybe to really start with, you know, like other parts of the world, Africa is undergoing a rapid demographic change. And while typically characterized as the youthful continent, you know, our mean age is only 19 years. It is a continent that is experiencing what we think is the highest increase in older persons, and will significantly have a 4-fold increase in the number of older persons by 2050. considered for us as a hallmark of development, maybe not sustainable development, but definitely development. We have seen that 69 million older persons account for 7.1% of the global population of older people. And as our current youth bulge, and if you know about the population pyramids and the age pyramids, Africa has a huge youth bulge, and that transitions into older age. The protected population figures in LD Africans by 2030 is 107 million, and by 2050, 226 million. So we really are seeing a transition. Life expectancy at birth in Africa is now 61 years. And I remember very clearly my late father, who passed last year, when he turned 60, he died at 86, had said, I'm living on borrowed time. And so indeed, we have seen significant improvements since our independence eras in the 1960s. But we really are still behind when it comes to global life expectancy, at least 9 years. And when one looks at what we call healthy life expectancy, the life in the region is spent generally in poor health. So all these sort of trends that we do see really call for a particular focus of the public sector and governments to really meet the needs and rights, not only of our youthful population, which indeed has been the agenda that Africa has pushed in what we call the demographic dividend agenda, but also in a growing cohort of older people. And one of the things that I think is important to raise at this point, predominantly also because as we look at the impact of COVID on the economies and the socioeconomic status of the population, we really need to sort of unpack a little bit the economic perspectives of older people, because indeed we may assume that people living in Africa, in particular older people, are living in poverty, and that's true, and unemployment is high. There are a high proportion of active elderly people over the age of 65 in the labor workforce, and although it's mainly dominated by men, they represent smallholder farmers, landholders. They do political, some of our presidents are one of the oldest in the world, but also traditional and religious leaders. And for older women, I think it's very clear that unpaid and unseen services to families and communities sort of characterize the nature of the informal work that they do. The family structure has changed with globalization, but I think what's key for us as a continent as well is that older persons continue to occupy that pride of place and respect in African societies. And therefore their contributions and voices, they're heard and they are valued. They might not always be sort of used to take on things, but definitely there is a space for them to be heard. And we look for better platforms as UNFPA to ensure that they are part of the thinking and really definitely rule older people. So it is a triumph of development for the continent. And the Africa Union, which is really our big institution that brings together the leadership of the continent, have made really important commitments to protect the rights and dignity of older people. They've adopted the protocol on the African Charter on Human and People's Rights, and frameworks that monitor and evaluate how countries are progressing in terms of those rights and any policy actions that they have taken. So allow me to shift to the second part, which is really around, I think, what we're here for, which is the COVID situation on the continent and its impact on older African persons. And I was telling Jane earlier that today or sometime, this weekend, we will reach 1 million confirmed COVID-19 cases on the continent and around 21,000 COVID-related deaths. there is a recognized fear that indeed the oldest are at the greatest risk. And in South Africa, where actually I am based and speaking from, where is the current epicenter of Africa's COVID pandemic, we do see that about 12 to 13% of confirmed cases are 60 years and over. But even what's more scary is at least 1 in every 2 COVID deaths are in that 60-year plus cohort. And similar to what we see, I think, across the world now, this higher risk of mortality and severe disease from COVID due to comorbidities or due to underlying conditions. And for us in this region and in the continent, of course, HIV, TB, diabetes, hypertension remain the comorbidities that for the most part we see and that build on in terms of risk for COVID. And that impact and risks are aggregated even more in humanitarian and fragile settings, whether they are conflict-related, climate-related, protracted, acute, on chronic. We have them all. I think Jane spoke to DRC and hotspots that we see there. The whole Great Lakes region in Eastern Africa is again a conflict area. We've recently seen desert locust swarms in Ethiopia and Kenya, and indeed presently Eastern Southern Africa, due to recurrent droughts and floods, have left 45 million in need across countries and communities in Southern Africa. And these also climate crisis has also impacted us. And last year we saw unprecedented events of back-to-back cyclones, whether striking Mozambique, it was Idaya, and then Kenneth. And so really the magnitude of humanitarian crisis in the region is really not only growing in frequency, but in the impact and the disruption it has on lives. And so we're forever treading as the UN system this humanitarian development peace nexus in pursuit of Africa's 2063 agenda, which is called the Africa We Want. And then came COVID. And to date, while the known numbers of COVID positive cases in refugee camps in Eastern Southern Africa are not recognized or considered to be very high compared to local communities and community spread in urban cities, it is exposing already existing inequalities and indeed diversities. And so what has it meant for older women? And I think I'd like to just highlight very quickly 3 areas of concerns we are seeing, and allow me to be a little bit more general than what's happening particularly in camps, because I think they are similar. And just as I said, first relates to the access to health care for older people and particularly older women. In the best of times, the healthcare systems in the region are weak, and COVID has simply exacerbated already what are strained public health systems, especially when it comes to health equity, when it comes to the quality of care, and when it comes to really just affordability of care. Many governments have imposed in the region very strict lockdowns, which have restricted movements in an effort to spread, to contain the spread. And what it has led to is really a deprioritization of some of the essential services and disruptions in routine health care visits to older persons, even just for their underlying health conditions that are not COVID related. So, and for UNFPA that deals with sexual and reproductive health, it has meant disruption of our antenatal and postnatal services, and particularly for elderly women who are either going through menopause, who are seeing gynecological issues, such as cervical cancer screening, reproductive tract sort of surgeries, uterine conditions, whether it's prolapse or uterine cancers, breast cancer, all those sorts of services have really been disrupted. So that's one thing that we've been particularly looking at and focused on. We also feel that the initial risk communication that happened did not really customize for older persons. And unlike young people who are digitally savvy and are aligned in the messagings they were getting from there, the digital divide really showed a generational divide. Then there was the disruption of supply chain systems for medication, including those chronic medication. And of course, in East and Southern Africa with the HIV pandemic, we do see an elderly cohort that are HIV positive, but also TB, hypertension. And so all that seemed to be disrupted in that early part of the response. Our frontline community workers and social service workers, including community-based distributors for us, are typically older women who are volunteering to support safe motherhood, child health, and they got scared, and rightly so, and so they pulled back for fear of their own personal health risk. And then there was the scarcity of PPE, and that, in a way, really took us back. And really, it has only taken us a while now to even get midwives to go back into labor wards. So there's all that issues around access that really has thrown us, and we're rushing against time, particularly for our older people, to ensure that this doesn't take hold. The second one I wanted to relate to was really the living conditions, and I'll go a little bit faster for older people, especially in the camp settings, because indeed, again, housing conditions, households in this part of the world, for the most part, are overcrowded anyway. But particularly in camps, we do see overcrowding, we do see poor water and sanitation facilities, and just not age-friendly in terms of just ability to move around. And I really think of, some of the sites in South Sudan and how women have to go out to fetch water and firewood, and not only their risks as older women, but also the imposed restrictions that have challenged their ability to do that. And so their lockdown really does affect them. And the third area is really the concern that we have around gender-based violence. In crisis situations, GBV rises, and in a way that we've known. And with COVID, it hasn't been any different. Early in the pandemic, UNFPA, and I think Jane was referring to it, we did some projections with Johns Hopkins, Avenir Health, and Victoria University to look at what extended periods of lockdown will do to affect not only the programs on GBV and our transformative result to end GBV by 2030. And we projected 31 million additional GBV cases if lockdowns continued for 6 months. And so really, in addition to a number of work we have been doing on vulnerability dashboards and tracking gender-based violence through management information systems in countries, and trying to disaggregate that by age, we are keeping track of, what's happening in terms of gender-based violence. But we also predict higher levels of what you've discussed, and we all know about ageism, isolation, poverty, nutritional needs, and neglect. And really working with the partners in the UN system, HelpAge, and what we call the Interagency Steering Committee of Humanitarian Partners, we really are vigilantly watching for human rights abuses. And so that's really the context that we've been working in. And UNFPA has done quite a number of things to advocate for PPE equipment for older people. We've been able to, in Kenya, for example, in our camps, with communication and language, really encouraged refugees to wear masks and to adhere to what they can in terms of sanitizing and washing in such difficult context. We've continued to provide services within camps, including on cervical screening. One of the things that is connected to our agenda on maternal health in Africa is obstetric fistula, which leads to incontinence. And for many older women who suffer these for many years, it is only when they get to a camp that they can actually be seen, and some of this is repaired. And so we're trying to keep that on track. We've also adapted our dignity kits. UNFPA in crisis settings comes in with dignity kits, with kits to ensure the continuation of maternal health. And we're looking at how we adapt that to the needs of older persons, you know, and what that needs, whether it's adult diapers, vaginal slur, creams, etc. And we've really tried to just align with the broader COVID infection protocols that you all heard about. If you look at the last session that our colleagues from DESA and OHCHR spoke about. So really that's, you know, been what we've been working at. And so let me really conclude with, I think, 3 areas that we as UNFPA feel need that added investments and attention related to aging in the region, and for which we continue to really value the partnership of civil society and development partners and individuals who support our work. First is around the evidence to make a stronger case for the investment and actions in Africa's aging agenda. Indeed, you know, we do feel that it is one that has somehow been put out there, but really hasn't really caught the traction that we really feel it needs to. And that, I think, is due to data and evidence and research and the paucity that exists. And really, again, I know you've talked in the past about data and disaggregated data. And so we really do feel that for Africa, that needs to be really enhanced. We need to be looking at the capacity of statistical organizations to actually be able to count the numbers of young people, to disaggregate, and we feel that should be in 5-year cohorts. So you can't just lump everybody over 60 or 65, because of course that changes. But also a little bit more around real-time data and what we're seeing, particularly in the context of COVID. And so that's something that I think there's a big research agenda out there. Definitely for us as SRH agency, we do see the needs, the sexual needs, and you know, those, whether it's menopause related, to older people and older women, really an area that's still not altogether clear. And I think as we look at a COVID agenda for aging, Africa is a good place to also look at in terms of what's happening there. The second area, I think, is really around the advocacy and activism that's needed. And I do feel that, you know, I talked to the Africa Protocol for older persons, you know, and really, in as much as it is a protocol, it has to be ratified and domesticated. And we still are not seeing every country take that up yet. You know, if you asked me in East and Southern Africa, which country has a very thought through healthy aging policy, that's not just health, but that's population related, or the national population policy. Mauritius is probably the only one I can, you know, say that is really looking at that. And of course, because indeed Mauritius is seeing its demographic transition and aging populations much more. So, but we do need to plan now for later, and therefore, you know, the advocacy that one can do around that, around gender, around human rights for older people and vulnerabilities, but also around their position is key. And maybe the third is really, again, around this policy program work, and really accountability, because indeed our heads of state sign up to all these protocols, but it doesn't really get, you know, sort of grounded. And so we, you know, with few programs that help age, and some of us are doing really to get much more in terms of policy, national policy and programs for older people, you know, it really does need that level of accountability and vigilance that we think is necessary. So those would be 3 sort of areas that we can start a discussion around. Of course, there are many areas and really, I know I've been quite long. I've told you about UNFP around aging in Africa, around the COVID situation. You know, but I'm sure we've only scratched the surface, and I'm so excited to be listening to also some of the views that you have, and how we can really work together, particularly for the people of Africa and the older people of Africa. I thank you, and Jane, over to you.
Thank you very much, Jolita. And I think, you know, you do need to take a bit more time than usual, because I think this is an area that not many of us would have, you know, hands-on experience and have a body of knowledge. So we thank you. There are a number of questions coming through. So fantastic. I will just move straight onto these questions and ask those that I call out, you know, to step up and see if we can make the questions quite short so that we can get through it a lot. So Kathleen Brasher, Chhatra Pradhan, and Paulette METANG. So Kathleen, welcome from Australia.
Thank you. Thank you very much. That was a beautiful presentation. Thank you so much for that. And I feel like you've given us such breadth of understanding. And I'm going to ask almost a personal question. I live in a small rural community in Victoria, in Australia. In our state, we've had an increased number of deaths, particularly in aged care facilities. The majority of our deaths are in aged care. We've gone down into a much more stringent lockdown as a result of an increase in numbers. And I find myself deeply personally affected. I feel like sometimes I've been hit in the chest some days when those numbers come through. And at the same time, I'm aware that I need to put what's happening to us into perspective and to find a space to reach out to sort of that shared sense of humanity about what's happening in Africa, what's happening in other parts of the world. And I'm wondering if you could just speak a little bit about how we find that connection and that space to manage how this impacts us personally.
Thank you, Kathleen, and thank you for sharing some of how I feel on a moment-to-moment basis. So thank you for that. Jolita, we'll just take one other question and then come back to you. So Chhatra, where are you online?
Yeah.
Welcome.
Doctor, thank you very much for your extensive presentation. And I would like to put a question from Nepal. Back to my country, older women are being discriminated by their own family members in every aspect of life, starting from food and family ceremonies, even to social events too. So this is my question. So how could we could manage for this situation?
Okay, thank you, Chhatra. And I will go on to ask Paulette, because your question also speaks to this issue, Paulette, and welcome from Cameroon.
Thank you, Jane. Good morning once more, everybody. Yes, in Cameroon, as I said, older women are located mainly in rural areas and are really discriminated, beginning by their families. And they have restricted means. You can say they are poor. They undergo health and nutrition problems. And the accusation of witchcraft is every day, almost every day. They are violated, even by their own families, by neighbors, and so on. So my question is that how can we manage to reduce this discrimination?
Okay, thank you very much, Paulette. So over to you, Jolita.
Thank you. These are very special questions for me. I want to really start with Kathleen, because in a way, you know, I think what COVID has done is sort of brought us all to the same sort of suffering and pain and you know, anxieties across the world. And I do think that we are seeing just as much the suffering in your part of the world as we do see in some of ours. And so that solidarity and that connection somehow does play out, not only on a personal level. I was telling Jane that I have, my 2 kids are in New York. And so they were together. Luckily, they locked down together at the time of really what was a really drastic sort of situation in New York. And they were, every night we would call each other and speak on the phone just to comfort each other and say, are you sure you're protecting yourself, etc. So I do think we have connected in important ways to address some of those pain and care that we all see in humanity caused by COVID, and also by the response in the way we've had to deal with this. And so in a way, I do feel on a personal note that these are the sort of areas and the stories that we need to continuously tell, and therefore platforms that allow us to have these conversations and how we lead through some of this become really fundamental and key. But also, I think for the continent, we really want to understand and learn across. And so I think this opportunity of knowledge exchange and sharing becomes really key in the way we move forward, and particularly for aging population. You know, care institutions are not typically the way we, you know, elderly people in Africa live. They remain living with communities and with families, but that is changing as well in the way they are treated, and some of the things that Paulette was talking about in terms of the discrimination that they continue to face through a life course. And so maybe I'll go on to the questions from Chhatra and Paulette, or just contribute. And I think, you know, it is fundamental that that we look particularly at elderly women and the discriminations they've faced. And it is a life course. It is across their life that these mount, and they don't stop in old age. And so indeed, as Chhatra was saying, in Nepal, we do know that, you know, it is what happens to the girl child early on that continues in terms of her position in place. UNFPA last month actually released our State of the World Population Report, and it's called Against My Will, and it's defying practices that are harmful, and specifically child marriage, female genital mutilation, and son preference. Those are the ones that they point, but there were 19 other customary harmful practices that happen, including what Paulette says as witchcraft, because an old woman has a red eyes because she's fanning fire flames, they assume that she is a witch, and then they abuse her. Similarly, there are customary practices in Africa which include widow cleansing. It includes wife inheritance. For the most part, the African woman will not have access to land. It's not inherited. Her son probably gets to inherit it before her. So there are a number of customary and traditional practices that women experience throughout their lives. And in a way, you know, by the time they get to, and this is what it's interesting in the report Against My Will, is how that even older women then become, because they're custodian of some of those practices, they actually put it on the other young person in the generation coming up. And so these are things that we really need to pay attention to. Indeed, you know, there are protocols now, and the African Union has particular agendas around child marriage, around, you know, the just the life course of the girl child in Africa, and the investment that one needs to change to make those changes as young as possible, so that as it transitions into older age, we are taking away that sort of those practices in the generation ahead. And these are some of the areas that, in fact, UNFPA is working on. We have an amazing elderly chief in Malawi who's been extremely excellent in actually motivating girls out of child marriage and working with parents to really save and rescue girls from child marriage. A lot of the work that we're seeing on gender-based violence and on harmful practices like FGM, it is the elderly women now that are they're dropping their blades. And they're really looking at the other ways in which they can do the rites of passage for young girls. So these are some of the things, and I know we have many more questions, so I'll stop there.
Well, we're just going to have to get you back again, Julita. All right. So 3 more questions. Anne-Marie Felton, Frances Zanadin, and Eileen from Ireland. So if you can, short questions. So Anne-Marie, welcome.
Thank you very much, Jane, and many congratulations to Dr. Julieta Banjo. Sorry, I may not pronounce your name properly. It is extremely moving and very clear. One of the areas, I have been part of many of these discussions now since the onset of COVID. It's fascinating as we come together and discuss to see the commonalities of the challenges that exist within each of our healthcare systems and across the global healthcare systems. Now, we know this, and I think we have to move beyond the discussion and the recognition of this. And in order to engage at a global political level for the re-examination of healthcare systems, the purposes for which they exist now and into the future, and the infrastructure that will sustain this. I think the time for polite conversation and acknowledging protocols which are not embedded in the countries, it must cease, because we, as well as everybody else, loses credibility. I am particularly interested just now, as we are addressing older people and the comments that Julieta has made with regard to the older woman. Now, women of a certain age may not be contributing to the directly to the economic viability of a country, but they are child carers. They are helping to manage so that their children can actually go out to work and so on. And this is not recognized, and it is a hidden contribution to the economic viability of households. And that is both women and men. The other practices that Julieta has outlined, which are abhorrent to all of us, however, there is this sensitivity about being culturally sensitive and not actually calling out these things. This is an affront to humanity, and it is, and we must get this message to say that it is not tolerable. I know in the United Kingdom certain steps have been made, but it is inadequate, and this is in law. So the COVID has both exposed and amplified the tragic weaknesses in our systems, and politically we have to engage. So here I go back. I can go on pontificating, and this is not what we want. We now need to set up a coherent action plan so that all ministries of health, and in fact our governments, become truly engaged. And I'm not, well, I don't know whether I'm suggesting this, but I am more and more impressed with the work of IFA and the leadership of IFA. It is actually spectacular, and I hope it will get a much broader platform. And I wonder, Jane, if you and your team and the board of IFA would consider engaging with WHO as being an honest broker in bringing about the restructuring and the revitalization of healthcare systems. I'll stop at that. That's just a small ask.
Jane, do you mind if I just quickly respond to that, because that was so excellent, Anne-Marie. Thank you. Your voice and your boldness around what needs to be done is really appreciated, and particularly around the global healthcare settings and the system. And you will realize that last year, you know, again, the UN in its effort around driving the Sustainable Development Goals to reach good health for all, and definitely this decade of action on healthy aging, sort of have tried to put squarely the healthcare needs of the elderly within the universal healthcare movement and momentum. And I don't think it's come out strong enough. And so I do think it's in that, and we are actually celebrating 1 year in September of the UHC political declaration. I think this is a good place to make exactly the cases that you are making as we think to rebuild back, and definitely rebuilding back includes what's going to happen to the public health system, to the health sector as a whole. We need to think about the investments that need to be made. We need to think about, and this is a time to think about all the parameters that would be needed to ensure that indeed we have a health system that is strong and is correct and is what it needs to be as we move forward towards 2030 and beyond. One of the areas that we've been looking at is climate change and how that is going to impact the delivery of health care, not only for the elderly, but for just populations, and what it means about health stress, heat stress, in the context of the work we do. What does it mean for structuring a primary health care clinic? What are the sorts of things they can handle at that case? So I do think that universal health care agenda, and this is where WHO is key, would be the place to anchor our rethink and resetting of what the healthcare system means, including the primary healthcare. There's going to be conversations around self-care, around telemedicine. What's that going to look like? And I think this is the time to think that through. Love the question about economic viability, and I think that's what I stressed at the beginning. We need to really, for Africa, unpack that informal healthcare and what that costs, and how that is being jeopardized because of these risks implied between COVID and transmission between younger generations and older generations. For HIV, it was a huge issue around when we lost the middle age, and therefore older people became households, unmanaged orphans. And so we've really looked at that, and we need to look at that again. And definitely the cultural issue. I think we're doing quite well in terms of just pinpointing and saying this is a human rights issue and therefore needs to be addressed. And so the African Union has done quite well in terms of looking at that. That said, we do realize that within culture, there are ways to address issues as well. And therefore, that's why we've been working with cultural leaders, religious leaders, and those who feel they have custodian, and really try to make them understand why this is a violation of rights and what it does. So I'll leave it at that.
Thank you, Julita. And
Thanks,
we'll take up, Anne-Marie will take up that baton and talk a little more about what we need to do rather than talk. We've just got very few minutes left, so I'll call on Francis and Eileen to come forward and to make sure that we give Julita a little bit of time to give us our messages at the end. So Francis?
Hi, good morning. Good afternoon. Thank you, Dr. Nabanjo, for your presentation. I was around when UNFPA was first established, believe it or not, many years ago. Yes, and I recognize the incredible work that it has done over the years in terms of family planning programs when it was first established to try and find ways to lower the fertility rates. And now that is more or less under control. I have 2 points. reproductive health, and I see the message behind you in terms of pregnancy and childbirth, etc. But I just wanted to make the point that reproductive health has, as is expected, I guess, focused on those of reproductive age. And current global women's health policies ignore reproductive biology, meaning older women suffer from, and you've mentioned this, older women suffer from fistula, cervical and breast cancers, hysterectomies, and surely reproductive and health policies should address the whole life course and not stop at 49 years old, which is technically, you know, the end of the reproductive life. My second question is that currently UNFPA, in its current strategy for 2018 to 2021, does not have activities related to older persons. And it is now preparing its strategy for 2022 to 2025. Will there be specific activities related to older persons?
Okay, thank you. Thank you, Francis. Just Eileen, just a quick question and then we'll wrap up.
Thank you very much for an excellent presentation. I'll just get to the point very quickly. I agree with Anne-Marie and I would support everything she's saying and the last speaker, Francis. Where I'm coming from is you've mentioned statistical information and you want to unpack the detail. We all know what gets measured gets done. And we've had that in previous speakers. And you also mentioned COVID is a disruptor. I'm at the stage where I'm now picking up the same message at all of the IFAs, but I need more action. I need an action plan on the ground, both at individual older persons and also tied into that public health access. It's not resumed as yet in Ireland because we're still catering with COVID. So the hospital system has not yet catered for that. I'll just leave those quickly with you for time constraints. Thank you very much for excellent presentation.
Thanks, Eileen. And over to you, Giulietta.
Thanks again. Excellent areas of Francis. It's good to know that 50 years ago when we were established, you were part of making that happen. Indeed, established as a population and demographic agency, and in the years have shifted now to a real focus on sexual reproductive health and rights. And indeed, that's why sexual is important, because we feel that the work that we do around sexual health and across a life course allows us to not just focus in on those that relate to women of reproductive age. And in a way, in as much as in principle, our ethos is around a life cycle approach to sexuality, to sexual and reproductive health. Our programs in the countries tend to have kind of focused, but that is changing. And I think this is where we've put the spotlight on things like gynecological issues, cervical cancer. In most of the work that we do in Africa, in East and Southern Africa, our portfolio includes the work around cancers, reproductive cancers or reproductive age, as you've put them, cancers, but also looking at the life course approach. And so that is something that we will continue to do. And it sort of spills into the second bit about our strategic plan. We do have older persons within the strategic plan. And indeed, as I mentioned, we have a UNFPA global aging program and a network that has really come to it a lot from the demographic perspective, but more and more we'll look at the health and the gender perspectives of that. And actually our executive board in our midterm review, which was just in June, specifically asked us to look at aging population a little bit more. So be assured that by the time we get to the new strategic plan in 2022, that would have been incorporated. Our biggest issue there is to look at the research, the innovation and the evidence that will ensure that we actually program that well with government. And in a way that leads on to, Eileen, your question around statistical information and the capacity across the continent, and how do we get that. And even with COVID, I mean, and as in, you know, UNFPA is also a data agency. We've been looking particularly, and this is why the work with Titchfield is in key, because it allows us to not only look at what guidance do we need to be telling our countries to collect data now, not only on the vulnerability of older persons, but also just their needs, and how we then feed that into planning and programming. So yes, work to be done, and definitely an area of agenda that I think is key. And so maybe, you know, Sarah, Jane, maybe I end on again, you know, it's been a really excellent set of sort of comments and conversations, and you know, and I think it's action we need, huh? That's what I hear, and we need it now. And you know, I think if globally we need it, in Africa we need it even more, because we do want to be able to ensure that as the aging population obviously grows rapidly on the continent, that we're ready to be able to ensure that you know, they have the dignity and the life that they well deserve. And so I do think we need to take action really quickly and now. The context is different, it matters, and we should build that on board. So really working with African networks. Help Age International has a really good set of people on ground. IFA, in some countries like in South Africa, you have network partners, but we really do need to look at who are those on the continent that can help us really move this agenda, not only for African elderly people, but globally, because I think, again, this is where it is. I think we do clearly realize that there is diversity amongst the older people, even in Africa. And, you know, they are those, you know, we don't have too much of this intergenerational wealth that others may have handed down, but it is growing. And so those who are older and rich, and so that, you know, even the disparities and inequalities within older populations, whether it's male, female, rich, poor, is showing through, and it's showing through in terms of their ability to survive, their ability to go abroad to get better health care, their ability to have the equipment and the surgery they need at the time they have. And in a way, this speaks to Paulette's view about what's happening in the older rural populations, and what are they getting access to, and how can we build that. And I think the intergenerational for us as Africa really makes a difference, and is important, both in terms of what the older can pass back, but also what the younger can do to support the older generation. And so we really are looking at that as well.
Thanks.
So that's me, Jane. Thanks, thank you.
Well, that's only a bit of you, and we've been honoured to sort of share our conversation with you this morning, and you with us. I think this is the beginning of a big conversation, Giulietta. We cannot stop here. The clear message from all the people, you know, in the chat box as well as questions is, you know, action, advocacy and activism is what's required going forward. And just because we don't know something, it doesn't mean that we can't be involved in something. And so I think that through bigger conversations, you know, we need to move into what does it mean to be a successful advocate, and how do we activate across sectors and across disciplines, and who can be champions, how can we be honest brokers, you know, in the formulation of systems that support people of all ages across the life course, but with a special focus for those, you know, older people and those with underlying conditions. You know, in wrapping up, I did want to just share with our town hall participants something that you said in a blog just recently, and I think it really is a defining moment. So if I can just share that with you. Older people have handed the mantle of preserving humanity onto the current working generation as we enjoy the fruits of their labour it is our duty to repay them by listening to them and looking after their today and their tomorrow. So in closing, thank you. It's been a joy and a privilege to have you with us today. I look forward to the next time and the next conversations, and thank you at UNFPA and all of your colleagues and other regional representatives that are with us today, and that we will be working with you in the future. So thank you very much, Julita.